Okay, beautiful. So again, from this list, we'll be doing the practical, which will be that Thursday of week 1. Your practical is just an identification assessment. What that means is that if you see the sternum there, you're going to say it's the sternum, and that is it. Okay, I'm not going to ask for parts of the sternum. Okay. Tomorrow, I'm going to go over each part of the bone and all the important parts of each of the bones. On the daily exams and quizzes, that is where I will ask you guys important questions, like something about the humeral head or the greater tubercle, what muscles attach to the greater tubercle. So it'll be on your exams where you will get those types of questions. It will not be on your pass-fail practicals. Okay? So again, the practical is an identification test, and that's it. All right? That's all it is. You're just going to identify the 35 to 45 bones that we put on the tables. All right? So any questions about that?
Good.
All right, so we're good. All right, so we're going to start. Let me pull up the bone practical information. All right, so what I'm going to do is I basically made a PowerPoint following this sheet. All right, for each bone, it's going to show the bone. And then what I'm going to do is on the bone itself that you're going to have for your practical, I'm basically going to show you where it is and what it is. Okay? So that's the way this is going to work. It's not that bad. And if you guys have any questions, stop me. All right? And I'll answer your questions. All righty?
Humerus.
Okay, let's start. All right, so like I said, if you have your sheet, I'm going to go basically by the sheet. So the first bone is the frontal bone on the skull, if I ever get to it. Doesn't want to move. Let's try it this way. All right. So the frontal bone, it forms the forehead and part of the roof of the cranium. So as you can see, the frontal bone is right in this area here. That's the frontal bone. So if I put a number like number 1 right here, you would say the frontal bone. Okay? This is what it'll be on. It'll be on a skull. All right? So the skull, this is the this is the facial portion of the skull. And we'll be working off of the cranium. We're not going to be working off of anything within the eye orbit or the nose. We're going to be working on with the mandible, but that'll be in a little bit. So the frontal bone is right here on the front, above the eyes, on the cranium. If you look, and this, because there's so much light here, it's really hard to see. There's some sutures along here. So when you guys come in, you can look for the sutures here on the front. All right? Those sutures basically differentiate the frontal bone from other parts of the cranium. So again, the frontal bone forms the forehead and part of the roof of the cranium. It is the bone above the eyes. The bone above the eyes is in this area right here. The second set of bones on the list, I guess I got to take that off, is the parietal bones. fix that. This. That'll be clear. All right. So the parietal bone forms most of the cranial roof and part of the lateral walls. So on the PowerPoint, you'll notice that the parietal bone is the area here in pink. It's the area here in pink. There's a parietal bone on the left side and there's a parietal bone on the right side. I won't ask for left and right. All right. And again, I won't be asking for the sutures or anything like that. On the top picture here, you see the separate, it's on the right-hand side here. And again, in the pink, right here on the side here, this is the parietal bone, right in that area here. On the skull itself, it's basically the middle portion of the cranium. So again, we have the frontal bone right here, and right behind it are the two parietal bones. Again, it forms the roof of the cranium. It also forms a part of the side, right in this area here, but not a very large part of it. Okay? So the parietal bone, again, is on the roof of the skull and forms part of the lateral walls. It's directly behind the frontal bone. Okay, so the parietal bone. Again, these are right now, we're working on the bones of the skull. The third bone will be the temporal bone. The temporal bone makes up the lateral wall and part of the floor of the cranium. It's in the temporal bone area where there are a lot of important landmarks, which we will be talking about tomorrow, such as the external auditory meatus, the styloid process, the mastoid process. These areas are going to be areas that you're going to need to know. Now, the temporal portion of the bone, let me pull it out here. It's this area right here in the purple area right here. Actually kind of goes like this a little bit. That is the temporal bone. The temporal bone on the skull will be this area here on the lateral side of the cranium. You'll know it by some important structures. The zygomatic arch right here is part of the temporal bone. The mastoid process, which is this soft, bony area that protrudes out and downwards, is part of the temporal bone. And the styloid process, which looks like a needle. Let me see if I can, it's this area right here. It looks like a needle coming out of the skull. When you guys are able to pick up the skull, you'll be able to see it quite easily. All right, it looks like a needle, and that is part of the temporal bone. All right, so again, the temporal bone is part of the lateral wall. And on this skull, it actually shows it in red right here. So here's the front. So you got the frontal bone right here, the two parietal bones above it. And right here on the side is the temporal bone. All right. What this is showing is actually there is a muscle that actually attaches right here onto the temporal bone. Thankfully, it won't be one that you'll need to know. But again, the temporal wall or the temporal bone makes up the lateral wall. And it's on this temporal bone that there are a lot of important structures. And these structures we will definitely be going over tomorrow. Okay. Let me clear that. Now that I have an idea of what I'm doing here, fantastic. All right. The fourth bone on the skull that we're going to look at is the occipital bone. The occipital bone is the rear or the base of the skull. So this is the back of your head. So guys, if you just feel the back of your head, you probably feel a little bump there. All right, that little bump is known as the external occipital protuberance. All right, and it's off of this structure that actually the upper trapezius comes off of that bony area right there. All right, that's the area of its origin. That's the origin of the upper trapezius. So the occipital bone is basically the back of the head. The foramen magnum, that big hole where the spinal cord goes through right here, that is part of the occipital bone. And on here, you see it quite easily. That's this hole right here, the large hole. Okay, so you got the brain in the cranium, and the spinal cord comes out, and the spinal cord comes out through the foramen magnum. And the foramen magnum is part of the occipital bone. Okay, so on the skull, you'll actually see it right here in this area here, in the red and the blue. All right, the red is showing actually where the upper trapezius actually is the origin of this. The origin of that muscle actually is here. And actually right here is that bump that I was telling you about and what you probably felt on your own heads. That's the, again, the external occipital protuberance. All right, right in this area here, there's an actual bump. And again, on week one, when you go through these bones and you're looking at them, you will find and see this area. Okay? So if I was to put a number right here, all you would have to tell me is that it is the occipital bone. Okay? So those are all the bones, thankfully, on the cranium that you'll need to know. The frontal, the parietal, the temporal, and the occipital bones. All righty. The next bone, won't advance that. Oh, it'll just right. Okay. Clear that. That. The next bone is the mandible. The mandible is really the only bone on the skull that moves. All right. So here's the bone itself. All right, here's the bone itself. On the bottom right here, you'll see the bone. Let me get my pen here. All right, it's this area right here we're looking at. The next two PowerPoints, this one and the next one, really do show the mandible really, really well. All right. So again, the mandible is the only part that really moves on the skull. And again, if you open your mouth and close your mouth, it's the mandible that's doing that work. You'll notice the teeth here. All right. You're not going to need to know anything about the teeth. I mean, if you were doing anything with the TMJ, which is a little bit more advanced for physical therapy, then you would probably learn a lot more about the teeth, the gomphosis, and things like that. But for the mandible, you're really only going to have to know a couple of parts of it. First part, again, is that you'll have to know that it is the mandible. And let me go to the next one because it's a much better drawing. Okay. So here's a really good picture of the mandible. All right. It shows the parts of the mandible that you will have to know. So along here, right here, you will have to know the body, the angle, the ramus. Again, you'll have to know this for the exam, but not for the practical. If this is on the table, all you'll have to tell me is that it's the mandible. All right. But there are parts of this bone that you will need to know. So when you're studying it, I would also study again the landmarks because you're going to need to know them anyway. Okay. You're going to need to know the mandibular condyle because it's at this condyle basically that articulates or connects with the skull that allows you to open and close your mouth. How about a little trick? Hey, John Carlos, how you doing, sir?
Doing good.
All right. Good to see you here.
Yep.
What I want you to do is, everybody can do it unless you got any ear problems. Take your finger and push it against that cartilage part of your ear and open and close your mouth. What you just felt was the temporomandibular joint on yourself. That was the TMJ opening and closing. Okay? So those mandibular condyles are important to know. The little hook area here is the mandibular notch. A nerve actually comes through that area. And the other part that you will need to know on the mandible is the coronoid process. All right. So basically on the mandible, you'll basically be needing to know. You get my pencil. Pencil always doesn't come out. There we go. So basically you'll need to know this area here. Okay, from the body, the angle, the ramus, the mandibular condyle, the coronoid process, and the mandibular notch. So those are the parts of the mandible that you will need to know. And of course, the mandible itself. All right. Any questions so far? Or are we doing okay?
Will you be sharing this PowerPoint with us? So we can review?
I will actually be sending you a more thorough PowerPoint tomorrow.
All right, thank you.
So you'll get the video, the video from tomorrow, and you'll get the you'll get the bone PowerPoint also. All right. This way it'll be a little bit easier for you guys to study.
We'll get today's video tomorrow.
No, I should be able to get today's video out today.
Okay, perfect.
All right, I'll be sending it out to everybody in the class. It just takes about a half an hour to download. So I just got to wait till it downloads, then I'll send it to everybody. There it is. All right. All righty. Next set of bones is going to be the vertebra. Now, when we're talking about the vertebra, each of the vertebrae are very, very different. And I need you to understand how to differentiate the vertebra. So this is really a really good slide on this PowerPoint because it actually breaks down the vertebra. And we're going to go through the vertebra itself in a few minutes. So when you're looking at the vertebra, you want to look at the bodies first. Now, remember, there are 3 sections of vertebra. We have the cervicals. There are 7 of those. The thoracic, there are 12 of those. And there are 5 lumbar vertebrae. Okay? And each one of them have different characteristics. All right? So I need you to understand some of the different characteristics. So the first part that you're going to look at is the body. Now, the body of the vertebra is on the anterior side. When you're looking at the cervical vertebra, the body is very small. The body is very, very small. The lumbar vertebra, the body is very, very thick. So if you see, let me get my pencil. So right here on the cervical vertebra, here's the cervical body right here. And here's the lumbar body right here. There's a huge difference in size. And when I show it to you, you'll see it. So here's a cervical vertebra right here. And on this top area right here, this is the body right here on the cervical vertebra. Very small. Compared with a lumbar vertebra, the body is very, very thick. All right. So that's one way of understanding the vertebra. The thoracic body is kind of in between. All right. So basically, the lumbar vertebra, definitely larger, the largest of the 3 types of vertebra. The spinous process. The spinous process is the part of your back that you can actually feel. All right, that's the pointy part of the vertebra. All right. And each of them are different on each of these vertebrae. On the cervical vertebra, it's something known as bifid. So here is the spinous process right here. And as you can see, there are actually 2 parts. It actually looks like it's split into 2. Most of the cervical vertebra, the spinous processes are bifid. And it will not be bifid on the thoracic, and it will not be bifid on the lumbar. The thoracic spinous process also has a different structure. With the thoracic, here is the spinous process here. On the thoracic vertebra, the spinous processes actually point downwards. Actually points downwards, where the cervical vertebra and the lumbar vertebra does not. All right? So thoracic vertebra, spinous process points downwards. On the lumbar vertebra, the spinous process is very short and very blunt. All right? There's definitely no bifid here. But as you can see, it's very, very, very small compared with the spinous process of the thoracic area. So you need to understand the different characteristics. There are different, the vertebral foramen, the middle part. Well, both the lumbar and the cervical have like a triangular foramen, where the thoracic has more of a circular foramen. Okay? So those are some of the ways you can differentiate between the thoracic, the cervical, and the lumbar. So again, if you take a look here, so this is a view from the top right here. That's a view from the top. Right here is a view from the side. And this is really a good view. You could see the spinous processes here on the cervical vertebra is that bifid look. You can see right here on the thoracic how spinous process goes in a downward way. And then you can also see on the lumbar vertebra how it's very, very blunt and short. Now, another way of understanding the difference between the vertebra is that on the thoracic vertebra, it's on the thoracic vertebra that the ribs connect to it. The ribs connect to the thoracic vertebra. The ribs do not connect to the cervical and do not connect to the lumbar. All right, so that's another way. You won't be able to see it, but there are actual, on the sides of the thoracic vertebra, there are smooth areas. And it's on those smooth areas where the rib, whenever we say the word articulate, it means that the bones are connecting, or the muscle and the bone are together. Articulation. It's on the thoracic vertebra where the ribs articulate with. Okay? So you need to understand the different characteristics of the vertebra. All right? We're going to go through some of them right now a little bit more. So in the cervical area, let me get rid of this, old drawings. All right. In the cervical area, we have two very, very special vertebrae. All right. The first one is C1. C1 is known as Atlas. Just like in Greek mythology, Atlas held up the world. Well, the Atlas or C1 holds your head up. All right. Atlas supports the head. An important part of the atlas is that it has no body. This bone has no body at all. It has two very important facets here, all right, that allow the head to sit on it. All right. So on the practical, if there's a number next to this, you'll either tell me it's C1 or Atlas. I don't care which one. That tells me that you know it. When we're talking about the exam, there's some important parts to this. Again, it has no body. And it's the atlas that allows you to move your head in the up and down position like this to basically say yes. So C1, atlas. All right, the first important cervical bone. The second important cervical bone is C2. C2 is known as the axis. C1 again allows this motion, yes. C2 allows this motion of no. All right. This bone also does not have a body, a true body, but it has a very, very special structure. That special structure is known as the dens. All right. On this bone, this pointy part that is sticking up is known as the odontoid process or the dens. All right. And this is the only bone, the only vertebra that has a dens. All right. So when you see the dens, what goes off in your head is that this is C2. Okay. So cervical vertebra number 2 has the dens. One other thing about the cervical vertebra that's different. There are these transverse processes that come out the sides of the vertebra. My apologies, I forgot. These transverse processes come out the side. And we have transverse processes on all the vertebrae, on the thoracic and the lumbar. But what's different about the cervical vertebra is that within the transverse process, there's an actual hole there on both of them in the cervical area. It allows for the nerves and the blood vessels to go up into the brain, right? So again, another characteristic that's different on the cervical vertebra is that there is these areas on the transverse process, these foramens that allow for the nerves and the blood vessels to go up into the brain. There are transverse processes on the thoracic and the lumbar, but there's no foramen on them. Okay. So again, C2 is known as the axis. And how you know it's C2 is the dens. All right, is the dens. So now let's look at each of the vertebra and go over those characteristics of each. So the typical cervical vertebra, again, this is C1 through C7. They're the smallest and the lightest. All right, they're very small and they're very light. Their spinous process from C2 through C6 is bifid, has this bifid look at the end. It has a very small body, all right, from C2 through C6. The transverse processes, again, has this transverse foramen. Here's the process. The foramen is the hole, and it allows for the arteries, the veins, and the nerves to go up into the brain. And again, these foramen, these transverse foramen, are only found on the cervical vertebra. An important vertebra is C7. If you feel on your back, if you go down your neck, you will actually feel a bump there. That's actually C7, and C7 is known as vertebra prominence. And it gives us an idea of where we are. It's a good mapping area. All right, so those are the important aspects of the cervical vertebra. The thoracic vertebra, again, looks like this, all right, with that spinous process pointing downwards. Again, there are 12. Now, I'm not going to question you on numbers. If you want to remember it, think of breakfast, lunch, and dinner. Cervical, breakfast starts at 7 o'clock. There are 7 cervical. Lunch is at 12 o'clock. There are 12 thoracic. Dinner, well, for old people like me, is at 5 o'clock. There are 5 lumbar vertebrae. So 7 cervical, 12 thoracic, and 5 lumbar. I won't question you on that. That's just some information for you. So again, there are 12 of them. The spinous processes are pointed and angled downwards, The body of the thoracic vertebra is larger than cervical, but smaller than lumbar. Only on the thoracic vertebra are these costal facets. Costal means ribs. It is only on the thoracic vertebra where the ribs attach to. Okay? There are also these inferior and superior facets, all right, that allow for the thoracic area to move, for you to be able to bend and to extend. So again, some of the important aspects of the thoracic vertebra: spinous process pointing downwards, the body larger than cervical, but smaller than lumbar. And this is the only vertebra that has costal facets for the ribs. Next one is the lumbar vertebra. Again, lumbar. Does anybody know why these are so big? Why these are so thick and the cervicals are so small? Anybody have an idea?
Holds more of our body weight.
Oh boy, does it hold a lot of body weight. Think of it, it holds most of our body weight. And what, that's one definitely good reason. There's another reason. Because we walk. When we walk, we're putting a lot of pressure on the bones. And when we walk, we put a lot of pressure on the lumbar vertebra. What happens is when we stress bone, bone grows. When we stress muscle, muscle gets stronger. Because we put so much stress on this bone gets thicker. Okay? So again, there are 5 of these. The body, this area right here, is very, very thick, very large. It's the largest of the 3 sections. The spinous process right here at the end is very short and very blunt. And there is these articular processes here on the top, all right? They face medially, where the other ones face anterior and posterior. And it allows the back and allows the lumbar area to rotate. Okay? You won't be able to miss this. If I put a number next to this, all you got to tell me, lumbar vertebra. Okay? So that's the vertebra. All right. The next one is the sacrum. Sorry. Wow, these are out of order. All right, we'll skip over the sternum, we'll get to it. This is the sacrum. All right, the sacrum, what you're looking at right now is actually the anterior side of the sacrum. And this is where L5 articulates with S1, sacrum 1, which is the top part of the bone right here. With the sacrum, you don't need to know a lot of parts of this, thankfully. All right, just the top of it, which is the sacral promontory, that you will need to know. And that it's the sacrum. Very easy bone to know. All right, it's this bone that articulates with the pelvis and creates the pelvis itself, the circular portion of the pelvis. So this is the sacrum. So what you're looking at here is the anterior view. It's very smooth. Very smooth on the anterior side. And it has to be. Think about it. A baby is really going to be in this area right here. This area has to be smooth. Excuse me. On the posterior portion of the sacrum, it's a little bit rougher. All right, a little bit rougher. You're not going to need to know the crest or anything like that. All right, you're not going to need to know any of those parts. We don't use them in physical therapy, so I'm not going to ask you about them. But I will need you to know that this is the sacrum, because when we get into the kinesiology portion, this sacrum moves in a very, very weird way. All right, we'll talk about that when we get there. So again, the sacrum. The bottom part of the sacrum is known as the coccyx bone. The coccyx are very, very small. They usually consist of 4 vertebrae. All right, if I point to this area, all you got to do is tell me it's the coccyx. I want to tell you something about these bones. They break very easily, especially on our elderly. Why do you think they break so easily on the elderly? What do you think? What do the elderly do?
They sit all day?
They sit all day. Well, hopefully they don't sit all day. But when they sit, they don't have a lot of control when they sit. So they actually, boom, right onto their bum. And they break their coccyx a lot. And it's very, very painful. And the problem is that we can't just stick a cast around the pelvis area. All right. So they actually have to walk around with the busted coccyx bone until it heals itself. Very small bone. You need to know the coccyx. It's attached to the sacrum. The thoracic cage or the sternum. All right. So this is where the ribs connect to. All right. But there's a bone in the middle that you're going to need to know. This is the sternum portion of the bone. All right. There are going to be parts of this bone that you're going to need to know. If you feel on yourself, you feel a little circular portion of the sternum on the top. Don't push too hard because it's going to hurt like the dickens. All right. This area is known as the jugular. It's the jugular notch right there. On each side of the jugular notch, there's a facet for the clavicle to attach to it. All right. Then we have the manubrium portion of the sternum. We have the body portion of the sternum. And on the bottom, we have the xiphoid process. All right. Let me actually get to the next PowerPoint here. Kind of goes over each of these parts. So again, on the manubrium portion, we have the jugular notch on the top. We have clavicular notches that articulate with the clavicle. So the manubrium is here on the top. On the body portion, that's where the ribs attach to the sternum. And then on the bottom, the xiphoid process. And the xiphoid process is actually an insertion point for the diaphragm. All right, that muscle that actually helps us breathe. Okay, so the sternum, again, on the practical, all you got to do is tell me this is the sternum. When we get to the exam portions, the quizzes, I'm going to quiz you on the landmarks. And let me also say this so that you feel a little bit more comfortable. All my quizzes are multiple choice. The answer is going to be there. You just need to know it. All right. Just like the national exam, all of my exams are multiple choice. There's no fill-ins. There's no matching on any of my exams. Okay. So one of those answers are going to be correct all the time. All right. So this is the sternum. You need to know the sternum. Ribs. Where's my rib? There it is. Okay. This is a rib. All right. Doesn't look tasty, I know. There's some good ribs. I wouldn't mind me some. See, now I'm getting hungry. All right. So it looks like we're having ribs tonight, me and my wife. Okay. So I will not ask you what number the rib is. All I will ask you is this a rib? Now, not a lot of physical therapy occurs with the ribs. If you break your rib, I mean, they can wrap you up and it really hurts, especially when you breathe. I don't know if anybody has ever had that happen to them. It really hurts if you break the rib. It really hurts if you pull a muscle that attaches to the rib, like internal and external intercostal muscles that go between the ribs. Man, a lot of pain. All you got to do is identify this as a rib. All right. The problem is that sometimes the rib looks a little like a clavicle. All right, looks a little like a clavicle. The rib is half a circle. It's half of an O. All right, it'll attach like this. And it only attaches to the thoracic vertebra. All right, to the sternum and to the thoracic vertebra. It doesn't attach to the cervical or the lumbar. We'll talk about false ribs and true ribs tomorrow. All right, I can't put that on the practical. So you can cross out false rib and floating rib and true rib and just put ribs on there. You just need to know what the rib looks like, okay? This bone is known as the clavicle. Do we have any people who like football here? Any Dallas Cowboy fans? It's known as the in my world, it's known as the Tony Romo bone, because this is the bone that he broke the most. New York Giants broke it. Philadelphia Eagles broke it. Washington Red Sox, the Washington football team broke it. And that's why Tony Romo is an announcer now, because of this bone. This is the most fractured bone in the body, by the way. Comes this way. This bone attaches the axial skeleton to the appendicular skeleton. It's this little bone. All right, this is an important bone. Remember, I said the rib looks like a half a zero, half an O. This bone looks like an S. It's S-shaped. All right, it has a very flat side and a side that is caved in a little bit. We'll talk about that tomorrow. But again, this is the clavicle. The clavicle attaches the sternum right here to the shoulder, basically. All right, the acromioclavicular joint, the acromion and the clavicle. So this is the clavicle. You need to know this bone. All right, sorry about that. This here is the scapula. This here is the scapula. What you're looking at right now is the posterior side of the scapula. You know it's the posterior side of the scapula because the spine of this, because you can see the spine of the scapula. This is the spine of the scapula right here. You know it's the posterior part because the spine of the scapula is there. This is the anterior portion of the scapula. It is a flat surface here. All right, a flat surface has the coracoid process sticking out. You're going to need to know that this is a scapula. And you're going to need to know whether it's a left or a right scapula. Okay. So if I point the scapula to you, so now I'm showing you the posterior side right here. All right, so here's the posterior side, and here's the anterior side. Right here is the glenoid fossa. The glenoid fossa is the area where the humerus attaches to. So if you're looking at the anterior side right here, picture it on you. Which scapula do you think this is? The anterior portion is facing you. So it looks like this. Is this a left scapula or a right? What do you guys think?
Left.
Huh? What'd you
Left.
say? Left.
I said left.
Good, because that's what it is. It is a left scapula. This is the anterior side. So if I was to put this right here, the posterior side would be facing back, the anterior side would be facing you, and the glenoid fossa would be on the lateral side where my humerus would attach to it. This is a left scapula. And right here, here's the anterior side here. Here's the glenoid fossa. This is a right scapula. So you're gonna need to know the difference between it. Now, when we go over the scapula tomorrow, there are a lot of landmarks you're going to need to know. All right. So be prepared. Scapula has about, what do we got? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 17 landmarks on the scapula itself. Those are the ones you're going to need to know for your exam. But if this is sitting on a table like this, I'll ask you, what bone is this? And you'll tell me a scapula. And then I might just say, is this a left or a right scapula? And then again, you just got to figure out which one's the anterior side, which one's the posterior side, and see where the glenoid fossa is. And we'll talk about the importance of the glenoid fossa tomorrow. So the scapula, very important bone, real important. How's everybody doing?
Good.
Questions?
Not yet.
Beautiful. All right. The next bone, the humerus. This is not the funny bone. Humerus, funny. All right. My days of being funny are over. By the way, is the funny bone a bone? My question of the day.
No.
No.
Nope. What is it?
Nerve.
Muscle.
It's a nerve. Exactly. It's a nerve. When you guys hit your elbow right here, and you can do it to yourself. All right. On your thumb side, feel the elbow, the area underneath on the underside, and you can actually make your fingers numb. That's the funny bone, believe it or not. All right, because it's not very funny when you hit it. Hurts like the dickens. All right, we'll talk about that in kinesiology. All right, this bone here is the humerus. All right. This is a very important bone. This is the bone that basically moves your arm. That helps to move your arm up and down. Helps to move your shoulder, ball and socket joint. Humeral head is right up here. There are a lot of important parts to this bone. You take a look at the picture. So again, right here is the humeral head. The humeral head articulates with the glenoid fossa on the scapula. There are two real important parts on the top of the humeral head. We have the greater tubercle and we have the lesser tubercle. These two bony projections are areas of muscle attachment. Some of the most important muscles that you will be working on in your career as a physical therapist assistant sits on those two tubercles? Anybody know the muscles? I'll tell you, but I'd rather hear it from you guys. Any thoughts on that?
Oh, the deltoid?
No, deltoid actually ends up here on the deltoid tuberosity. And its origin is actually on the clavicle, the acromion, and the spine of the scapula. We'll get to that tomorrow. But anybody ever hear of the rotator cuff muscles? Anybody hear of rotator cuff muscles?
I've heard of people tearing rotator cuff muscles.
Oh yeah, we tear rotator cuff muscles. Well, there are 4 rotator cuff muscles. The supraspinatus, the infraspinatus, the teres minor. Those 3 muscles insert onto the greater tubercle. The infraspinatus, which is the 4th muscle, inserts onto the lesser tubercle. Those 4 muscles keep basically the tendons of those 4 muscles keeps the humeral head in the glenoid fossa. That's their job. That's what they do. And yes, rotator cuff muscles tear an awful lot, especially the supraspinatus. Okay. In between those 2 tubercles is an area known as the intertubercular sulcus. You probably heard of the bicipital groove. It is this area where the biceps, the long head of the biceps, actually goes through that groove. So you're going to need to know that. The deltoid tuberosity is right here in the middle of the humerus, and that's where the deltoid inserts onto. On the bottom here are the bony areas of the elbow, where the radius and the ulnar articulate with these areas here and allow to create the hinge joint of the elbow. So again, the humerus has a really important part here, the humeral head, and it kind of looks like this bone right here, which is the femur, just much smaller. But there's a big difference. Again, it's much smaller, like I just said, but on the bottom, right here in this area here, or let me point to this on the picture, in this area here, there's this capitulum and trochlea area on the humerus. And it's this area here that articulates with the radius and the ulnar to allow the elbow to flex and extend. It allows this motion and the motion of supination and pronation when the hand comes over like this. So the humerus is the only bone that has this capitulum and trochlea right here. On the back of the bone, it has this olecranon fossa that allows the part of the ulna to actually articulate with it and allows it to move. So the humerus, all right, has the humeral head and the important part at the distal portion, the capitulum and the trochlea. Erase. The next bone is known as the radius. Radius is a very, very small, thin bone, right? If you take a look at your forearm, this area here, between your elbow and your wrist. This is your forearm. The bone on your thumb side, the bone on the thumb side of the forearm is the radius bone. This radius bone looks like a lower extremity bone also. Kind of looks like a fibula. It really looks like it. But there's a very special part of the radius that differentiates it. On the top of the radius, there is a round circular area here. This area of the radius is known as the head of the radius. There is a head of fibula, but it doesn't look like this. It's not rounded. And you can't see it very well here. Maybe you can. If you look on the inside here, there's an indent. That indent is known as a fovea. And that fovea allows this bone to move on the capitulum of the humerus. It allows for this bone to spin in order to pronate and supinate, because it's the radius that moves, not the ulna. So the biggest difference is this radial head, the head of the radius. On the bottom part of the bone, there's a styloid process. You can feel it on yourself. There's a small bone here, way under the thumb. That's your styloid process of your thumb, on the thumb side. Also on this bone is a very bumpy area right here. All right. This bumpy area is the radial tuberosity. And it's at the radial tuberosity that the biceps tendon connects. So the biceps goes all the way from the shoulder all the way to the forearm. So the biceps has a lot of actions. So the radius bone, a small, thin bone, the radial head is the characteristic that differentiates it from any bone, any other bone. And this radial head is actually at the top here, connected to the elbow. Okay? So the radius, one of the bones of the forearm. The other bone of the forearm is known as the ulna. The ulna, let me get my pen. The ulna is this bone right here. The ulna is the pinky side bone of the forearm. The bone on the pinky side. Again, very thin looking. You can kind of mix up this bone for the radius also, if you just look at it. But again, there's a really important characteristic. And the important characteristic is this trochlear notch right here. All right, the trochlear notch, which looks like something that's going to grab onto something. Well, this area grabs on to the trochlea of the humerus and allows for movement, inflection, and extension. This trochlear notch is the characteristic that differentiates it from any other bone. Okay, there are parts of this that you're going to need to know. All right, but this is the ulna. So if I have it out like this, it'll be sitting so you can see this notch. And all you would tell me is this is an ulnar, and I'll mark it correct. All right, so this is the other bone of the forearm, the ulnar bone. Questions on the radius, the humerus, and the ulna? For that's the three important bones of the arm. for that. All right, let's get to the hand. Now, on the list here, it just shows carpal bones. I am going to need more. Okay. The carpal bones are basically made of 8 bones. 2 rows of 4. When I put it on the table, it'll look like this. And the bones that I'm going to want will be colored in. There is a proximal row and a distal row of carpal bones. The proximal row, anything that is proximal, is closer to the body. Anything that is distal is further from the body. We'll learn about those things on Wednesday when I do the Wednesday video. The proximal row of carpal bones going from the thumb side is the scaphoid, the lunate, the triquetrum, and the pisiform. Let me get my pen out here somewhere. Come on, Mr. Pen. There you go. All right. These bones in yellow is the proximal set of bones. So the scaphoid is this bone right here. The lunate is right next to it, is right there. The triquetrum is this yellow bone on the bottom, and the pisiform is this bone right here on top of the triquetrum. Scaphoid, lunate, triquetrum, and pisiform. That is the proximal row of carpal bones. For those of you that were part of the orientation, I think I told you guys that I'm going to need those bones. So if you haven't been part of it, please write that down. Instead of under carpal bones, write proximal row, scaphoid, lunate, triquetrum, and pisiform. And that's going from the thumb side going across to the pinky side. That's the way it goes. The best way to remember it too. All right? So that's the proximal set of bones. The distal set of bones here is in green. It's these bones right here above the proximal bones. Again, the green bones are further away from the body, closer to the fingers. The distal bones is the trapezium right there. The trapezoid, the smaller bone. The capitate, which is the largest of all the carpal bones. And finally, the hamate. So the distal row of bones is distal row of carpals that you're going to need to know is the trapezium, the trapezoid, the capitate, and the hamate. The way it's going to work is, again, I'm going to take this hand and I'm going to color in a row of bones, either the proximal row or the distal row. And then you will name that row of bones. Okay? I got 2 hands, so I'll be able to do 2 rows. I can tell you they won't be together. All right? You might have one on one table on the first set of tables, and you might have another one on the last set of tables. Okay? You're going to have to name the carpal bones. Worth 8 points. If you get 6 of them, I'll give you 6 points. I will give partial credit for this. All right. Know the bones by the row. I'll color the row. If you ask me what row it is, I will give you the row. That's not a problem. But you got to name them. Okay. So again, the proximal row of carpal bones is the scaphoid, the lunate, the triquetrum, and the pisiform. The distal row of carpals is the trapezium, the trapezoid, the capitate, and the hamate. You need to know those 8 bones.
The way you have them written is always in order from thumb to pinky?
Thumb to pinky. Yes, sir.
Okay.
And it's the easiest way to remember it. Just know, if you could just know it from thumb to pinky. All righty. All right. So those are the carpals. The metacarpals and the phalanges. So right above the carpals are the metacarpals. So the wrist bones, the carpals, are these small bones right here. Right above it are the metacarpals. They're these longer bones that attach. The articulation or the joint between the carpals and the metacarpals is known as the carpal metacarpal joint, or CMC. Carpal metacarpal joint. So these first set of long bones are the metacarpals. Then above the metacarpals are basically another 12 bones on the fingers and 2 on the thumb. These are known as the phalanges. You'll notice here on the picture, let me get my pen back. So here's the metacarpals right here, these long bones. And these bones right here are the phalanges. On the digits, each finger has 3 phalanges. On the thumb, there's 2 phalanges. Each of these creates a joint. So the joint between the metacarpals and the first phalange is the metacarpal phalangeal joint. That's known as the MCP. You're going to find out in kinesiology that the MCP joint is your knuckles. The MCP is your knuckles. The next joint above it on the finger is the proximal interphalangeal joint, the PIP. So if you were to just move the PIP like this would be flexion of the PIP joint. And there's only one muscle. Oh, there's 2 muscles that actually do that. Then you have another joint, which is the distal interphalangeal joint, the DIP, at the end of those 4 digits. And there's only one muscle that does that. So we'll talk about that one. So the joints that you will eventually need to know: CMC, carpal metacarpal; the MCP, metacarpal phalangeal, the knuckles; the PIP and the DIP, proximal interphalangeal and distal interphalangeal joints. All right. Let's get rid of that. Rid of my pencil. All right, we're on the lower extremity. Any questions right now on the upper extremity?
No.
Excuse me, sorry. All right. And so, when we're talking about the pelvis, excuse me, we're going to basically break the pelvis up into basically one bone right here. All right. And on this bone, we have a section called the ilium, a section called the ischium, and a section called the pubis. So when we put the whole thing together for the pelvis, it looks like this. All right. So both sides of the pelvis connected with the sacrum, and that creates the pelvic girdle. All right, it's this area here that most of the lower organs basically sit, and basically where a baby's head comes through when ladies are giving birth. You'll find out that on the ladies, this area right here is larger than men, and it makes sense. Look at the size of this cabeza. It's a big old head. My mom pushed this head through that small hole. I don't know how you women do it. So kudos to you, because I would cry like a little baby. That's a lot of pain. So the pelvic girdle, please understand that it's made up of 2 of these pelvic bones and the sacrum. All right. This is a very large support for the lower extremity. Okay. So what you're going to need to know. All right, let's go to the next PowerPoint. So the hip bone itself. So again, there's a left and a right hip bone. I'm not going to ask you which is a left and which is a right. All right. You will know the inside of the hip bone by a very rough area on the side. If there's no rough area, that's the outside. You'll know it by the rough area on the inside, and the acetabulum, which is the articulation for the femoral head that allows you to flex and extend your leg. This area is on the outside of the leg. This rough area right here, and you can actually see that one. This rough area here is where the sacrum attaches to it. Okay. So let's take a look at it the way it would be in the picture. This upper half that's tan in the picture is the ilium section of the hip bone. The ilium section. You know what it's going to be, the ilium section, because the top of it has the iliac crest. This area right here is the iliac crest. So this top section here is the ilium. The next section is known as the ischium. Now, the ischium is the back of the bone. It's the posterior portion of the hip bone. And it has an important section known as the ischial tuberosity. That's this section right here. What do we do with our ischial tuberosity. What are we doing with it right now? What do you guys think?
Sitting.
That's exactly right. We sit on our ischial tuberosity. The ischial tuberosity is the back. It's your butt bone is the ischial tuberosity. So the ischium portion of the hip bone is the posterior portion. It's a little bit rough here. Here's the thing, on the practical, you can't touch it. Remember, everybody has to be able to see the bone the same exact way. So you can't touch the bones and move them. So we'll talk about that, but you can't touch them. But it's definitely different from the front side, which is much smoother and pointed. So we got the ilium, the top portion. We got the posterior portion, which is the ischium. And we have the front portion, which is the pubic bone or the pubis. And so you can see the pubis right here on the picture. It's a pointed area. It's this area in pink. It's different than this rounded area right here on the ischium. More rounded. This one's pointed. So what important landmark does this bone basically create on the pelvic girdle? What do you guys think? Let me get rid of this. Let me move it back to the pelvic girdle. It's the pubis. So what sounds like the pubis?
Pubic.
Pubic what?
Oh, girdle.
No, not the pubic girdle. There's an important landmark right here. So here's the two pubises. They come here. Here's one.
Pubic syphilis?
The pubic symphysis.
Oh, symphysis.
Yeah, not the pubic syphilis. That's a good one. The pubic symphysis. All right, that's where that disc is. All right, that connects these two hip bones. It's the pubis area. Sorry, the pubis area right here. That there's a piece of cartilage that goes in between it that allows for the creation of the pelvic girdle. Little interesting story. The ladies, when they're pregnant, actually give off a hormone. Yeah, they have lots of hormones, we know. But they give a certain hormone that actually softens the ligaments and the tendons and the cartilage that allows for them to kind of give in order for the baby to be born. So what happens is when that hormone is released, it actually enlarges the pelvic opening and softens the pubic symphysis area. Like I said, you women are amazing. So just some interesting stuff. So when we're talking about the pelvic bone, I need you to know the three parts of the pelvic bone. I need you to know the ilium portion. The ilium portion is this tan portion on this picture. Come on, Mr. Penn. Pen doesn't like to come out. There it is. So again, tan portion right here. And actually, part of it actually goes into the acetabulum. The tan portion, this large portion right here, is the ilium. The posterior portion of the hip bone is the ischium. That's where the ischial tuberosity is. And the front portion, or the anterior portion, is the pubis, or the pubic bone. Okay, this area right here. And that's on your sheet. The ilium, the ischium, and the pubic bone. All right, we went over the sacrum and the coccyx. Let's go to the femur. All right, get rid of this. Femur, very large bone in the lower extremity. There'll be a lot of things that we talk about tomorrow with this bone. But for today, this is the femur. All right, it's the largest bone, strongest, heaviest bone. Just like you guys said earlier, all the body weight really is on the femur and on those lower extremity bones, and that's why they're so darn thick, right? Because as we put pressure and stress on it, they grow stronger in order to handle that stress. There's a femoral head here on the top that articulates with the acetabulum, this area right here, this hole. Femoral head goes in there, allows us to flex and extend our hip. On the bottom of the femur, there are condyles, smooth condyles. All right? Just like the humerus has a greater and lesser tubercle, the femur has a greater and lesser trochanter. Again, important bony landmarks for muscles and an area that we use for goniometric measurements, and or these are landmarks that we use. That's why they're so important, because you're going to have to tell us what landmarks you use when you're doing goniometric measurements in month number 4. So, big, thick leg bone, the femur. All right, we'll talk about all the landmarks on this bone that you'll need to know tomorrow. This one you really can't miss. Our patella. All right, you won't have to know which side is the anterior or which side is the posterior, but you will have to know which side is the apex and which side is the base, and we will talk about that tomorrow. The patella basically is between the femur and the tibia. It is a bone known as a sesamoid bone, and a sesamoid bone is a bone that is embedded in a tendon. The other sesamoid bone is actually in the wrist, and that's the pisiform. This bone, the patella, is embedded in the quadriceps tendon. Right? So this patella is really important and gives a mechanical advantage. All right, a little bit of physics that you're going to have to know eventually. All right, the patella gives a mechanical advantage to the quadriceps and allows it to be about 25 to 30% stronger with the patella there. When the patella isn't there, the quads are not as strong. So the patella, very important. I will only take patella. I will not take kneecap. All right, this one you need to know it as the patella. All right, so the patella bone. The next bone of the lower extremity is the tibia. All right, the tibia, again, another thick bone. This bone is not as long as the femur. Femur, much, much longer than the tibia. The tibia, area of the shin, articulates with the condyles of the femur here on the top. These areas here. These areas here also has the meniscus of the knee and also ACL and PCL, important ligaments that basically keep physical therapists and physical therapist assistants in jobs, because those tendons and those ligaments are always tearing, and the surgeons fix them and then we rehab them. Anybody again watch the football game this weekend? Cincinnati quarterback unfortunately tore his ACL, his anterior cruciate ligaments, which are attached to the tibia. An important part of this bone is on the anterior side is the tibial tuberosity. I don't know if you can see, there's a bump right here. The bump area right here. And it's at this tibial tuberosity that the quadriceps tendon attaches to this bone and allows for us to extend the knee. The quadriceps extends the knee. So this tibial tuberosity is a real important landmark on the tibia. Another aspect of the tibia is the distal portion of the tibia. What I want you to do is feel your ankle bone on the inside. The medial malleolus is part of the tibia. The medial malleolus is part of the tibia. So this bone right here is the tibia. Has a few important landmarks that differentiate it from any other bone. All right, so tibia. The fibula is a strut bone. All right, the fibula is located on the lateral side of the leg. As you can see, it's very, very thin. It really does not have a weight-bearing function. This bone breaks very easily. It helps stabilize the ankle. So remember, I just said the tibia, the lower half of the tibia is the medial malleolus. Well, the distal end of the fibula is the lateral malleolus. It's the lateral bone, the lateral ankle bone. So basically, it's the tibia and fibula that make up those two bony parts that protrude out on the ankle. So again, this is the fibula, thin bone. All right. It has a fibular head, which is a little half circular, and its distal end actually points to it like a head right down here. And again, creating the lateral malleolus. So that is the fibula. All right. We only got a few more bones left. So now we got the bones of the foot. All right. I think I got some better pictures tomorrow, by the way. So, all right. The first bone of the foot that you're going to need to know is the talus. The talus, so here's the foot. The talus is the largest tarsal bone. It is the top bone. It is the top bone on the foot. It's this talus that articulates with the medial and lateral malleolus, allowing the ankle to flex, which is known as dorsiflexion, or extend, which is known as plantar flexion. That happens at the joint created between the talus and the medial and lateral malleolus. So the talus is the top part of the foot. The next bone that you need to know, we'll go backwards, is the calcaneus. That is basically your heel. I'm sorry, calcaneus is the largest bone. Talus is the most superior bone. My apologies. Calcaneus is that thick bone. It forms your heel. And it's where the Achilles tendon attaches. So this calcaneus is the back part, is the backbone on the foot. The talus is the top bone on the foot. So the talus is superior. The calcaneus is beneath it. Big, thick bone right here. The next bone is the navicular. Now, the navicular bone is on the medial side of the foot. How do you know the medial side of the foot? What's going to tell you that?
Your big toe, probably.
Big toe. You got it. The big toe is going to tell you what side of the foot you're on. If you have the big toe, you are on the medial side of the foot. All right. Toe number 5 is the lateral side. The navicular bone. Let me see if I have it on the other picture. If not, it'll be tomorrow's. Yeah, I got it. I got it tomorrow. The navicular bone is the bone after the talus. The navicular bone sticks out, okay, known as the navicular tuberosity. So I'll show you a better picture of it tomorrow. And when you guys get in here and you're looking at the bones, it'll be quite evident which one is the navicular. All right. Finally, we have the metatarsals. Just like the metacarpals was the long bone of the hand, the metatarsals are the long bones of the foot. These bones right here, the metatarsals. Don't get confused between carpals and tarsals. Carpals is the wrist, tarsals is the foot. The metatarsals are the long bones of the foot. Okay. These are all, it sounds like a lot. I think there's 37 or 38 bones or 39, somewhere around there, not including the 8. So it's got to be about 47 now, I guess. That's going to be on your practical. And again, all you got to do is identify the bone, basically. Thankfully, you have 7 weeks to study it. And during the first week, you'll be able to look at the bones and practice on the bones. See the bones that are actually going to be on the practical itself. Let me also say this. Over the next 4 weeks, if you guys want to come in and look at the bones, you are welcome to. You just got to contact me so I can get the bones out for you and be there to try to assist you. But if you want to look at the bones, come with a plan, email me, say, listen, Mr. Dunn, I'd like to be, Wednesday, maybe around 3, you don't have to do it for long periods of time. but I want to give you the opportunity to be able to look and touch the bones, so you get a better idea of what you're looking at and what you're doing. So if you want to do that, email me. All right, just email me. I'm here pretty much every day till 4 or 5, except for Thursdays. All right, and I will stay later if need be. All right, as long as I know you're coming, I will stay till 5, 6 o'clock. All right, and stay till 7 if you want to look at it. You don't have to stay for long and spend 2, 3 hours. If you spend an hour 2 or 3 times over the next 7 weeks, you're going to get what you need. I recommend that you do that. Do it. All right. I want to give you this option. So again, if you want to look at the bones, email me. We'll set up a time. We'll get you in here. Okay? Any questions? Go ahead. Any questions for day 1?
I have a question about the hip bone. Will you be testing us on the ilium and the 3 different sections of it?
The
For the
ilium,
practical?
the ilium, the ischium, and the pubic bone.
Okay, perfect.
So those 3 sections, the ilium, which is the superior section, the ischium, which is the posterior section, and the pubis, which is the anterior medial section. That's what
I got a question.
that's what we'll test you on. Yes.
I got a question, sir. So the trail guide,
Yep.
the book that you were discussing last time.
Yeah.
So Kaiser bookstore, they only have the digital. Would you suggest getting the spiral? Like, what do you think? Like,
I haven't seen the digital. I guess that would be it would be on your computer.
Yeah, it would.
Would you be able to bring your computer on campus?
I would, yeah, but would it just be easier to do, like, or do we need it like handy with us in class, like just to?
It will be very useful because for the intro class, to really get an understanding of the bones and the muscles, and in the kinesiology class, it gives you a mapping of how to palpate these bones and muscles. It gives you a map of it. Like if I was to ask you to palpate the spine of the scapula, the way I tell you to do that is follow the clavicle up to the acromion process, feel the acromion process, and then go back onto the spine of the scapula. That's your spine of the scapula. It gives you a map of it. So I would definitely recommend that you have your trail guide right there with you and literally read it out loud, because you'll be practicing it. So if you had an iPad, or if you have an iPad, digital might be better.
No.
Digital might be better. The book, I can't believe that's all they have.
Yeah.
Get it on Amazon. It'll be cheaper.
Okay.
I
think they only had the 6th. I think they only had the 6th edition too.
That's fine.
That's
fine. There's really no difference.
Okay.
It's just a way they want to make money.
Okay.
You didn't hear that. Oh, it says recorded. You didn't hear that.
All right. Thank you.
No problem. Anybody else?
One last question.
No problem.
For the flashcards, it would be from the same book, right? The Trail Guide to the Body. You said there was like some flashcards that would be very useful from the book.
Give me 1 second. They are. Give me 1 second. So, like I said in the orientation, I use the Trail Guide flashcards. It looks like this. I use it on the muscle practical. I will use the actual trail guide. I'll use the actual trail guide flashcards on the practical itself. Let me just stop sharing. Give me 1 second. Okay. Okay. I'm not pushing the trail guide flashcards in any way, shape, or form. It's the ones that have been given to me, so I definitely will use them. My recommendation is that you either purchase a set of flashcards or make your own, because they're incredibly helpful. Whichever ones you get are going to help you. Even ones that you would get maybe on your phone as an app. It's going to help you out. Anything that's going to help you study, that's going to help you remember those muscles, any way is a good way. All I'm saying is that during the practical, I will use, I mean, let's say it's the sternocleidomastoid. I'll use a picture, let's say, of the sternocleidomastoid from the flashcard itself. So that's all I'm saying, is that I do use the cards on the practical. So that's up to you. Oh, Nels is here. Good deal. Sorry, Nels, didn't get to see you.
I joined a little late. I'm
That's
gonna have to
okay.
listen to that the first
That's
30.
That's okay. Anytime's a good time. And you can listen to the rest of it later. That's good.
Okay.
That's good. Glad you're here. So I think, to be honest with you, I think flashcards are a great way to learn. For me personally, I mean, and we're talking 20 years ago, I made my own. What I did was, I mean, I didn't have a picture of the muscle. So I would put the name of the muscle. I wrote the origin, the insertion, the action, and then the innervation. And that's how I studied, because I learn better when I write. Guys, these things are there for you already. They're already out there. I find them incredibly useful, and I know the students do also, that have already taken these classes. So any kind of flashcards are going to be helpful. Okay. I'm not an advertiser for the trail guide. I think the trail guide's excellent. It's a fantastic tool for you to study with. All right. Anybody else? Good. All right. So this is what's going to happen tomorrow. So tomorrow, 2 o'clock, what I'm going to be doing is I'm going to go through all of these bones and all of the landmarks that you're going to need to know for the exams and quizzes. All right. All of the important landmarks. So when, like, your practical is going to be telling me what bone it is, on the exam, I might have a question talking about the scapula, saying this bone has the okay. Let's say it was the let's just say it's the clavicle. This bone has a has an origin for the anterior deltoid and an insertion for the upper trapezius. It would be the lateral 1/3 of the clavicle. And again, on the exams and quizzes, they're multiple choice. You'll have 4 answers. All right, so the answer will be there. So tomorrow we'll be going over these bones and how important they are and the important landmarks and the important parts of it. Okay?
Sounds good.
Okay, if you guys have any questions, write them down. Email me. All right, I'm just going to basically get the tape loaded up, and I'll send it to everybody today. Okay,
Thank you.
no problem. All right, guys, have a good afternoon. Hey, we
You
finished
too.
10 minutes early. Cool beans.
You too. Thank you.
I doubt we're going to finish 10 minutes early tomorrow. All right, guys, have a good afternoon. Thank you.
Thank you.
You're welcome.